Hot flash is inevitable, just like how menopause is inevitable for everyone. Does every woman go through hot flashes during a perimenopause or menopause?
So one of the big studies, the SWAN study, has come out, which shows that the hot flashes vary by ethnicity and socioeconomic factors and triggers. So the worse, the Black and Hispanic women have the most hot flashes, and East Asian and Japanese have the least hot flashes. So there's an ethnic component to that. So again, when you see a patient in the office, you need to look at the patient holistically and say, it's just not one size fits all.
Right.
So that's a big socioeconomic factors are a big factor. Low socioeconomic status, usually they have more hot flashes. Triggers, how much alcohol are you having? How much of coffee are you having? Your stress, all of these things make hot flashes worse.
Right. You mentioned caffeine, alcohol, stress. What about sleep? Any other triggers that can completely change the way you experience hot flashes? Because I, in my personal experience, I was sort of hot flash free for a couple of years, and suddenly came a very stressful period, and started experiencing them all over again. And I was like, oh my God, I didn't expect this to come back again. So, but are there any other factors that you would call triggers for hot flashes?
Sure, teenagers at home. I'm just
Well,
they would definitely trigger a hot flash.
that's a good one. All right.
So no, so definitely anything, if you've gone through a particularly stressful period, you're probably going to face a lot more hot flashes. So that's a definite trigger. Like I said, alcohol, caffeine. The other thing I've noticed is people sometimes hot flashes are okay in the summer because they're regulating their temperature with their air condition or whatever. But when it's the change of seasons, especially in the fall or going to winter, that is when people feel like they're having more hot flashes. Now,
Oh,
yeah, so again, it may be your temperature regulation. You're probably outside in the heat and then coming in to a really cold room or vice versa. This is a lot of my patients have noticed this. Now, I don't have studies. I have to go find a study to correlate that with the change of seasons, but